and thank you for inviting me. So this talk that I'm going to deliver today, it's about our recent publication, which took 1.5 years in coming. We started off in March 2020, in the early stages of the pandemic, with a survey. The survey was designed in 2 days, and in 2 days it was made online, and then we kept on adding different languages to it. So what we were looking for is predictors and outcomes of individuals' knowledge. How does it affect different factors, and what are the predictors of what are the predictors of individual having the knowledge about COVID-19? So, oh, okay, you can see my screen, yeah. Okay, so in March 2020, along with the pandemic, the COVID-19 pandemic, there were also another pandemic going parallelly, which was about misinformation. And there were a lot of media outlets, European police and World Health Organization, United Nations, everybody was trying to create awareness, but this was an unprecedented event, and nobody was actually prepared for such level of handling information in an emergency situation, which is really fluid. Because when I say fluid is the knowledge was changing every day. So something that was true today was not true the next day. So it was very difficult to circulate one news and then the next day go about it, say, oh no, that was not correct, now this is correct. This happened especially with the masks in the early stages. So there was a lot of fake news out there. People were creating alarms, especially in Europe. We had a shortage of toilet paper, so they were just toilet papers disappeared because somebody said that there is a problem with the factories which are producing toilet paper. So it was kind of a very bad situation during that time with the information. These are some more examples, and I quote that the WizGuard Insight, it said that the world has to take unprecedented action if we want to actually not just scrub the pandemic from the health point of view, but scrub the pandemic and its after effects in terms of the information or the impact of what people know about the pandemic itself. So what we did, what we were looking at, we were majorly looking at sources of information. So conventional sources of, sorry for that. Okay, sources of information, and how does this sources of information relate with public opinion and individual behavior? And for that, we had two research questions basically. First was to see how people access these information sources. How do they perceive, what is the perceived credibility of the information sources? For example, do people perceive Facebook as credible, or the information that they receive from Facebook as credible, or what they get from TV news, is that credible or not credible? And how is it associated with the knowledge that people possess? And the second question was that if people possess certain level of knowledge, what is their opinion, or what is their behavior towards what is required to curb the pandemic? So these were the two research questions that we went forward with, because we were trying to do an exploratory research to see, and we did not have as much time at that point to form hypothesis. So we just went with forward with the research questions, and we constructed something called CPK, which later we actually turned it to IKC, so individuals' knowledge on COVID-19. It was just like a different phrase that we used, but COVID-19 Perceived Knowledge Index was what we created, which consisted of 25 questions. So 25 different variables, and these were variables which consisted of general knowledge about COVID-19 during that time, which I'm talking about March to April 2020. The knowledge regarding how to prevent COVID, and the knowledge regarding the myths and the facts of COVID-19. And we took World Health Organization's website as the base of the information, because there was something that happened on social media. I will refer to it later, where there were some good things that came out of this pandemic, and which can be used in the future as well. So we took WHO's website as the base of the knowledge, and then we carried it forward from there. So the framework was that on the left side, we had these predictors, and then we had the CPK, which is like COVID-19 perceived knowledge index, or we can call IKC, which is individuals knowledge on COVID-19. And then on the right hand side we had the outcomes of it. And what we had on the left side is what we said, the individual's knowledge. What we hypothesized or what we framed was that social media multitasking, the frequency of receiving information, people's knowledge about how they can safeguard themselves against fake information, how many different social media do they use, how many conventional channels do they use, and lastly, about the number of cases in the country of their nationality and the country where they're residing, because we had a lot of people who were not staying in the same country as they belong to, but they had relatives back home. Like for instance, for me, I was in Poland, or I am in Poland right now, but my parents are back in India. So somehow I am affected by the number of cases in both countries. So this is what we thought that was predicting the knowledge that people have. And on the other side, we had the outcomes as like social distancing behavior, how much fear people have regarding COVID, because fear was again contributing to other like opinions, the willingness to all volunteer and help others, willingness to help the quarantine, because the quarantine were not allowed to go out. So they still needed groceries, they still needed things that they need in their day-to-day life, or they need some medicines, for instance, but they were not allowed to go out. So that was also a very important behavior, or the willingness that was required from people. We also looked at whether the knowledge had any impact on the satisfaction with government actions, which was actually very interesting. I will come to it when we discuss the results. And the perception of the impact of COVID, not just during the lockdown, the first one, or in times to come, or the basically when would the COVID-19 pandemic end, was one of the interesting outcomes, which was related to the knowledge. So we collected, I will go through this part quickly, just because this is just about the technicalities of it. So it was a self-administered online questionnaire. It was in 27 languages, 76 mandatory questions, 15 additional conditional questions, with 2 open-ended questions. When I say additional conditional questions were like, okay, we asked about kids, if they had kids. If we asked about, say, work or business related, then if they had business, they had business related questions, and so on. 2 open-ended questions where we asked them to give some input. We have not yet analyzed that part, because we had so many people who actually wrote almost like 1-page responses. After filling like 70, 80 questions, they still spent like 10-15 minutes to write in different languages. So we still are in the process of working on that data, which we did not use in this study. And we got about 15,552 responses from 123 countries. There were more or less about 20 countries which were more dominant in terms of responses, and there were a lot of countries where we had just a few responses, like 1 or 2 responses. And what we concentrated on was global internet users. So when we compared the representativeness of the demographics, we were talking about only global internet users, because we only use the online medium to reach the users. Okay, so there were 4 sections: the attitudes and behavior section, the individual social media use section, the demographic section, and the propensity to retrieve further information on COVID-19. Then what we did was to explain CPK, to explain as the predictors. We use multiple regressions with CPK as a dependent variable. And for the outcome side, that is for the right hand side, we had 9 multinomial logic models and 2 logic models and 1 multiple regression model. I will talk more about the discussion part, which is like the results, the impact of the results, or the implications of the result, rather than going into the statistic part of it. Right, so these are the interesting results. So first, what we found was that people who still have faith, or who considered traditional media, which is like national TV news, radios, newspaper, this as credible, they had higher knowledge of COVID-19 as compared to people who considered them less credible. So for instance, if I consider newspaper, as you can see, the green part is like the good part, and the red part is like not so good part, significantly. And the black part is like, it doesn't matter. So if I was one of the respondents and I was saying that I trust the news that I get from the TV news, then I would have higher COVID-19, higher COVID related knowledge as compared to if I considered that as less credible. And if you look at the offline social network or the social network, so any discussion that was happening among like the people who we know around us, general people who we know, friends, family, colleagues, and also the things that we were discussing on social media, all of them were having statistically significant less knowledge about COVID-19 as compared to people who considered that to be not credible. So we see that people getting knowledge in such a situation still requires an established norm of media rather than the new age media that we are currently that we have a very big amount at the moment. There were two things about the social media. One was Reddit. Now on Reddit, it is again a very it's a very different kind of social network where people usually discuss on the topic of their expertise. So here, if people were going on Reddit and discussing it and perceiving the knowledge that they got from that source as credible, then they had higher knowledge of COVID-19 as compared to if they considered it as neutral or as not credible. And with LinkedIn, so this again distinguishes LinkedIn, say from Facebook, for instance, that people who are staying neutral about the information that was available on LinkedIn, like still questioning whether it is right or whether it is wrong, not considering it, oh, it is wrong or it is right, then they were having a higher knowledge of COVID as compared to the other two stratas. And another good thing was about the official sources, the family doctors. Of course, this is intuitive that if you talk with a doctor, they are supposed to have the knowledge about this. So this can be seen that there is a statistically significant positive effect if they trusted the doctors or if they asked the doctors about it. Thereafter, we also have the World Health Organization website. I mean, that is something that had to be positive, because if that was considered to be negative, then there was something wrong with the study, because we took the base as as WHO's website. And this was another interesting result, that the government website, people who were following government websites to get information regarding COVID, were having did not have any significant effect on their knowledge. So there were two things that we observed because of this. We observed few government websites, and in the initial part of the pandemic, it took a lot of time for the governments to actually establish COVID-19 online information centers. As I was mentioning, there's something interesting happened with social media. One of the thing was that if today, if you actually go on social media, especially Facebook or on Instagram, and if you write anything related to, which has keywords related to the pandemic, like COVID, coronavirus, or anything like that, as soon as the post is published, there will be a link to that post to the local government's website, which this is something which had been never done before. So what it basically did was, there was a notice that, for to get trusted news or updates regarding COVID, you should go to the government's website. So now our hypothesis is that if we do the same survey now, then the government websites would have a statistically significant positive effect. But at that time, it did not. Also regarding the search engines, so there was a lot of misinformation. Practically like millions of people were just blogging about things that they did not know about. So and they basically write SEO optimized blogs, which are actually better than the articles which are just published for the information, not from the point of view of optimized for the search engine. So as you can see, people who were just relying on search engine to get information, credible information, were having statistically less credible information or less information regarding COVID. Now, if we see, if somebody had the knowledge regarding COVID, then, oh, sorry, no, this is still, we still have positive effect of if they were multitasking, is referred to people using multiple sources of information. So if I receive one particular information, I would like go to different sources of information, and I would like to try to verify it. The frequency of checking posts was also found to be positive. The trust in the government was also found to be positive. Also, it was also a very these are, as you can see in the green, adopting suspicious behavior, questioning the sender about the news, cross-referencing with other sources of information, and discussing with friends and families. These were like these were seen as positively affecting the knowledge, and as points which people should follow to safeguard themselves from misinformation. These were the controls, and here we had a very interesting observation in the controls. One, the people were not affected by the number of cases globally, but they were affected by the number of cases locally. So if to like talk about this, so if I am in Poland and if the number of cases in Poland are growing, then I'm scared and I want to know about COVID. But if something is happening in other part of the world, I don't care. So this is something that is very interesting, because this has now changed. People are now getting more information about these things which might come and affect them. And this has happened previously with the immigration or migration of refugees also. This has happened previously, but it happened to a very small place in Europe. So it was not something that was taken to the global, did not drive people to know about it. But here in this case, now they have learned a lesson. So we see that this could change if the survey is done now as compared to when it was actually done. And men had a lower knowledge about COVID as compared to women, which kind of also makes sense, because there have been studies in the literature which say that online, on the internet, women kind of are more critical towards what information they perceive, or they employ more methods of safeguarding themselves from fake information as compared to men. So this was also something that was confirmed by our studies as well. Another interesting result was the marital status. So if somebody was single, they were prone to have less knowledge of COVID as compared to somebody who had a family. So people who had a family or who were living with their partners were more concerned about it and got more knowledge about COVID as compared to people who are single. Right. On the other side, when we talk about the outcomes of COVID, we found that if somebody had the knowledge about COVID-19, here you can see the first thing about stocking up groceries. So people who had higher knowledge of COVID were less likely to stock up their groceries as compared to people who had less knowledge of COVID. So here we can see that what I was talking about, that toilet paper thing, that if people had proper knowledge of COVID, they would realize that the supply chains are hindered, but they can still work in a way that everybody will get most of the things that are required in a day-to-day basis. But people who, if they have less knowledge, they would panic more and they will like stock up their groceries, and then there will be shortage in the supermarkets. We also found a positive effect of knowledge in people willing to volunteer, elderly people, or people who are in quarantine, for instance. Also, as we can see, the social distancing behavior was positive. So people who had higher knowledge of COVID were displayed the behavior of or agreed that they are going to socially distance themselves, or they socially distance themselves. But as compared to people who had less knowledge of COVID. And also people who were having this higher knowledge also were in favor of government imposing travel bans, for instance. Or they wanted to get more information regarding COVID, and if they were not sure whether they will get COVID again if they catch once. So this was also something, because it was a fluid situation, and we are still like seeing that people who get COVID even after vaccination can get the infection again. So people who had higher knowledge were kind of aware of this factor and were still practicing social distancing. And this is like people who had higher knowledge were not satisfied with the government's response as compared to people who had less knowledge about COVID. So people who had less knowledge about COVID, they were like, okay, our government has done well. But whereas people who had higher knowledge of COVID, they were like unsatisfied with the government's response to COVID-19. And lastly, this was also interesting, because people who had higher knowledge were less scared of this pandemic as compared to people who had less knowledge. So if we look at the aggregation of all these factors, we can simply conclude that the factor that we developed, the individual knowledge of COVID-19 factor that we developed, was predicting all the behaviors and opinion, or the kind of the thing that people should be aware about, were more in favor and could contribute towards curbing of the pandemic as compared to people who had less knowledge. Also, there are people who had higher knowledge were more likely to perceive that there could be positive effects of the pandemic. There would be positive outcomes rather than just concentrating on the negative ones. Then they were willing, there was no statistical like significant relation between them agreeing to give advice to the government, but there was that they thought that expected impact of perception of COVID-19 would be positive rather than negative. So there were like a 12 point scale, 12 item scale that we aggregated, and it was found that overall people perceive that it could be positive in the end. So just to summarize, what were the main findings? So the sources of information could be any, but the personal perception of its credibility is what plays a major role. So if I trust a source of information, and the information that I get from that source, if I don't question it, then that is something that would affect the misinformation that I receive. So personal credibility or personal perception of the source's credibility is very important. And our study suggests that every online social media or the search engines, if we get information from there, we have to perceive it as not credible and then move ahead. We have to like question whether it can be right or wrong, rather than just say, oh, I read it on Google and it is fine. The next thing is resorting to different social media. It exposes individuals to a broader perspective and hence reduces the chance of misinformation. For instance, if I go and read something on Facebook, and if I go and read something on LinkedIn, and if both of them are not like the same, then I already question okay, two places, two different information. So it's always important. It's important to do multitasking rather than just depending on one source of information. Open discussions on social media should be avoided. They result in flawed opinions rather than facts. And moreover, there is also a reason why this happens, because say World Health Organization is posting something on Facebook, and if there are millions of people who are discussing about the same topic, then it is more likely that the higher kind of discussion which is happening in the public domain will reach to more number of people as compared to something which is happening from a single domain or a single page. So instead of like discussing among and commenting on irrelevant posts, which can be true or false, it is very important to go to these trusted or official sources of information and then discuss there, so that that post reaches to more number of people on social media. Offline discussions are more constructive, because one of the reasons what we found, or was as a discussion argument that we found for this, was that if I'm talking with somebody in real, then that person is close to me and that person can also get infected. So probably we both care more about discussing some things which are real, rather than just like talking about anything that we don't know about. Global number of cases are not perceived did not have as much effect as the local number of cases, which is something also that we recommend that in the future we should look at such events which have which are happening in different parts of the world. It's very important to keep ourselves updated with that, so that because something that is happening in the other part of the world can happen on our part of the world in a few days time or in a few weeks time. And this kind of the knowledge index about any event on a mass scale is very important to be developed, and it is having a significant relation with how people act. So that also has also reaffirms what is confirmed in the literature multiple times, that if proper awareness is spread about certain topic, then people act in the desired manner towards favoring the curbing of the pandemic, for instance, in this case. For the future research, there were a lot of bots, so we did not go into that depth with the social media bots and spread of information. There was some research, but still there wasn't significant research. So that is something where still in some emergency situations in some different parts of the world, this is something that can be researched upon. Fact checking has become a norm nowadays, but still news related to the pandemic and health issues in general was not curated properly. And there are like social media channels are now like having their own fact checking agencies basically to try and curb this misinformation, not just about COVID but in general. But still there is future research that could set an agenda for these massive businesses to like bring in their share on and control this epidemic of misinformation. And of course, yeah, we did it in a global stage, and such studies, if done locally in countries, they could yield more representative results for the country. We did take into account all the nationalities. We did use it as a control variable, but still, when we talk about 7 countries or more than 7 countries, then we just could represent the global internet users rather than going for one or two specific countries, because there were a lot of countries which actually did quite a lot in terms of communicating with the citizens. For instance, in Scandinavia, in Denmark, I think there were messages which were sent out to the citizens, whereas say in other countries there were not. So there was a significant difference between how those people reacted to the information that they got from, say, social media or the internet, as compared to people who did not to get such news. Yeah, so that's it from me. I would like to mention that over 50 volunteers from different countries helped us to get this data and translate the survey into 27 different languages. So in the paper, we have acknowledged every single one of them. And also all my co-authors here from different countries. We have from Denmark, France, Iceland and Sweden, Italy, Portugal, Brazil, China, Germany, and Poland.